like you're not gonna heal all the way right away. All right. There's again no such thing as accelerated healing. All right. And so what happens is once the healing begins, the healing cannot begin until you treat the wound. But you can't treat the wound unless you identify the wound, and you can't, and you're not going to be able to identify the wound unless you expose the wound. All right. So the first thing that happens when you have a wound that's bleeding profusely, because you might have more than one wound, but if you got that one wound that's bleeding profusely, you're going to treat that wound first, because that wound is the most intense wound right there. And so what they want you to do is, when it's talking about applying pressure and dressing it up, all right, until you can figure out, okay, what's the best course of action to handle this wound. Now, this wound, because it's the most severe wound, it's going to take a lot longer than the other small wounds to heal. So those wounds, again, may require just some Neosporin, a little Band-Aid,